Welcome to RiverBanks TV, a show that aims to answer your aesthetic questions and introduce you to the wonderful world of RiverBanks Clinic.
We're opening the doors of this beautiful clinic to reveal what happens inside. We'll meet some people who have had treatments here, as well as look at the trends and treatments that Dr. Ravi Jain, the lead aesthetic physician here, has been performing. First, let's take a look at some trends which have been making the news recently.
If you missed the London Olympics in 2012, you must have been living on Mars. And the popular event has made its mark in more ways than one. With all those toned stomachs and six-packs on display, there was a noticeable uptake in body contouring procedures from people wanting a shortcut to reducing stomach fat. Now the trend has continued, and now popular lunch break procedures such as the Cool-Tech fat freezing are in more demand than ever. Cool-Tech is an amazing procedure. Finally, it's possible to lose fat without surgery or exercise. Clinical studies of fat freezing show that just a single 1-hour session can reduce the number of fat cells by up to 45%.
There used to be a time when men didn't have aesthetic treatments, or if they did, they certainly didn't shout about it. But it seems that maybe the British man has mellowed a little, set aside his pride, and is now happy to talk about his love affair with injectables. Thanks in part to high-profile men such as Simon Cowell and Gordon Ramsay embracing anti-aging procedures, more men than ever are enjoying the benefits of dermal fillers and Botox. There are several types of fillers, each with their own benefits and effects. The ones which RiverBanks use are Restylane and the most advanced hyaluronic acid of them all, Emervel. Along with Botox, dermal fillers command a market in non-surgical cosmetic procedures worth £775 million, which is expected to grow by 8.4% in the next year. Restylane, the most popular filler, has been used in 16 million treatments worldwide since it was launched 16 years ago. That's 1 million treatments a year. If, like Chef Gordon Ramsay, you find your face has deep lines, RiverBanks can create a bespoke solution for you.
Are you spending hours in the gym trying to keep your figure in shape whilst being concerned about lines and wrinkles? Maybe even having anti-wrinkle injections such as Botox? Wouldn't it be great if you could reduce the fat where you didn't want it whilst getting the toned and well-defined body you want? You might have heard of stem cell treatments, such as the one in the headline. But a new treatment at RiverBanks Clinic could prove the answer to your fitness and aging. It's probably better than stem cell treatments. Now, anti-aging plus fat loss is what you get with facial fat transfer. Vaser 4D Sculpt takes the fat from where you'd rather not have it and transfers it to where you would get greater definition. Now, it's a minimally invasive procedure that gives you greater definition of your pecs, pert-lifted buttocks, a more defined waistline, smoother, more youthful looking hands and skin. Now, the procedure is safe and has minimal recovery time compared to previous techniques. Now, the results look natural. Your clothes will fit better, your confidence will be lifted, and your friends will think you've been working out. Definitely a case of 2 birds with 1 stone, or should I say, 2 problems with 1 treatment. These days, people are swamped with a huge range of different treatments for the same problem. Gone are the days where you went to your surgeon for a facelift to solve your anti-aging problems. It sometimes seems that everyday newspapers feature the latest anti-aging solution. At RiverBanks, Dr. Jain and his team perform 2 of the most popular wrinkle reduction treatments, dermal fillers and Botox. But how do you know which one is best for you? Is there even a difference? Well, maybe it's time we found out. Let's go and have a look. I'm in the treatment room where the magic begins. Now I'm here with Kelly and Dr. Jain, and we're going to be looking at a botulinum toxin injection treatment. So Kelly, first of all, why did you decide to have botulinum toxin or Botox treatments in the first place?
Because I had really visible lines and I just needed to feel fresh and nice again.
Was it
instead
because...
of haggard.
Now, was that your own perception or was it through others,
I think so.
So you've had treatments in the past?
Yes, just Botox before.
Great, and how many times have you had that now?
About 5 times.
So
Yeah,
it's a
about
regular
5
thing?
times. Yeah, like every 6 months.
Are you addicted to it?
Yeah. No, not at all.
No, you're
Just
not.
like it.
Okay, well, great. So I'm here with Dr. Jane. Now, do you want to just take us through what happens from start to finish?
Of course. Right, Kelly, if you just rest your head back first. Okay, so today we're going to do a review treatment for Kelly, and I'm just going to mark out for you the areas I'll be injecting. So we tend to inject, to help treat the frown line in the middle, I will inject a point just in the glabella, and then one on the corrugator muscles here. And these are areas which will help me give the best result and give a best brow shape as well. And then to help give a bit of a brow elevation, I'll just put a little bit of botulinum toxin around the eyes, and this will help reduce some of the dreaded crow's feet, and also a tiny bit there.
How important is it to mark up the patient? Because you hear of a lot of doctors saying, oh, you know, they're in and out of the office in 10 minutes, but how important is it to do the mark? Because it obviously takes time.
Well, I mean, you need to, to be honest, I'm doing this purely for demonstration purposes, okay? Once you get to know, you need to see the anatomy and you need to see how the muscles are moving, okay? And I think don't be too fussed by people not doing the markup or doing the markup. The key is, are they going to give you the best results, okay? And you can judge that by your friends who've been to see the doctor maybe, or even by you know, their previous results. And they've shown you, that doctor's shown you their results. I don't take photos in this, I take videos to show people the difference in movements, because the Botox treatments are a very dynamic treatment. Right. Okay, so now that we've cleansed the area, we've marked the area, I'm just going to start a treatment. Right, okay, so we're just going to do your first injection.
So you're only putting in small amounts, to overcome this, you know, we talk about this frozen face type of things.
Very small amounts. It's a very fine needle, as you can see here, which causes minimal pain.
Is Kelly having obviously top-up treatments?
This is a top-up treatment today, but to be honest, each treatment is similar. Okay, are you all right? Mm-hmm. Okay. And then Kelly, if you just look to your left, please.
Now, those wrinkles around the eyes, are they mainly from squinting and...
There. How dare you? How dare you say that? I don't know what wrinkles you can see, Stephen. Okay.
Hypothetically.
Yeah, was he talking to me? I think you're right, Kelly. Okay. There we are. These are, I mean, sometimes you get some fine ones under the eyes. They're quite difficult to treat with botulinum toxin. And usually they just need a combination of some light therapy, or such as the Omnilux system, and also good copious amounts of sleep.
I think that's what I need. I think we all need a bit of that.
Yes, there we are. So that's it. You can see that there's no bruising, hardly any bleeding, and that's actually a treatment with the botulinum toxin.
So Kelly, one question that a lot of viewers ask is, you know, does it hurt?
No, not at all. Really doesn't. If you relax, and it doesn't hurt. It's just like little tiny pricks.
Super, and it's over pretty quickly.
Yeah, it's cool.
Every week, RiverBanks receives questions from around the world about all types of procedures. Now, if you have a question, then you can email us or tweet in, and you'll see all those details at the end of the show. Now, I've got a bunch of questions for Dr. Ravi Jain. Welcome to the show.
Good morning.
So we've just had an email from Caroline from Preston, and she says that she's overweight but needs to tone her arms and stomach. Now, do you have a particular treatment that you would recommend for Caroline?
These are very common questions and concerns a lot of women have, is their arms and their stomachs. The first thing though, we have to address the cause of it, okay? And is it dietary issues? Are there lack of exercise issues, okay? And we have to address those before we think of any medical or cosmetic intervention, okay? For the patients that come here, we tend to say to them, these patients have actually, their diet's very good, and you find that they are exercising. In fact, many of them invested in a personal trainer as well. And they've done that, and they're still really not reaching their goals, their body shape goals. Then we can offer there's a couple of options we can help them. You can either go through a non-surgical solutions, which help tone the skin, help tone the muscle, help tone the fat, okay, and improve the appearance of it on a temporary basis. There are some non-surgical options that work on a permanent basis, and these are really exciting, and I want to talk to you about those, okay? Yeah. And then there's the surgical solutions such as the vasolipo, which is a bit more invasive. There's a bit more commitment required, but it's pretty much guaranteed and can be life-changing.
I'm sure, like Caroline, like other women, they're always worried about downtime. Yeah. Are things going to be painful? I think men worse than women.
Well, that I don't know, but the other subject that's very important in this, you mentioned nutrition.
Yes.
You know, just for people to understand that this is not a situation where you can say, let's say, binge and then come for a treatment, and that's okay because you can let yourself go later on anyway. It really is a committed procedure from the patient as well, of course, as the clinic, isn't it?
Absolutely. I mean, first of all, if they're not controlling their diet or their lifestyle, and they're going to throw their money away, really, with any treatment we can offer them. So for me, it's very important to offer patients the right advice because I'm mindful of how much money they're going to be spending, and I want them to get the best value for money, really, for what they do. So, you know, often, always, the question I ask my patients, the very first question I ask is, what do you eat on a daily basis? Tell me what you had for breakfast this morning. What did you have for dinner last night? And that gives me an idea of their nutritional status, and also it gives me an idea of maybe some foods they're having which they think are healthy for them may not be the right thing for them.
So would it be therefore good advice to see a nutritionist?
Yeah, we often do recommend that.
Very good.
Yeah.
So before we move on to the next tweet or email, what are the top 3 treatments or main treatment that you do for toning the arms?
For arms, we would arms, we'd probably look at the Med Contour as a toning treatment, then the Cool Tech, which is fat freezing to help reduce the fat, and then as the surgical one would be the vasolipo, and that's probably the most popular.
Super.
Now the next Monica from Newcastle tweeted, is liposuction the only way I can banish my love handles and thighs?
No, and it goes back to the previous question actually, you know, look at your diet and exercise.
Doesn't it?
If we've exhausted that avenue, then we can look for abdomen and flanks. I would definitely talk about the Cool Tech fat freezing as the first option if they're averse to surgery, because we've seen some remarkably good, it's really surprised me even, okay, and I love my vasolipo. I think, you know, we can give fantastic shapes with that, but now for the first time I've seen a device that can actually shrink fat without going under the knife, and it works and it's permanent, so that's a good option for people.
Do you see a trend more towards before the summer of women or men having these types of lipo treatments, or is it all year round?
Absolutely. For example, for the first half of this year now, we've already beaten last year's whole year figures. The figures this year, the demand for body contouring is tremendous.
Because it was interesting from Barb's, they released the statistics that lipo procedures had decreased, but obviously that's not representative of the whole market, is it?
That's right. I think it represents a certain market, the Barb's market, okay, and certainly from our point of view, it's up and up and up.
Super. Well, we've got another question, and this is from Natalie in Eastbourne. Now, no cellulite cream she's used has ever worked. Is there some type of miracle treatment out there for these types of women?
Tell us.
If I had that cream, we wouldn't be sitting here talking for a start. But cellulite is a difficult condition for many women, okay, and it's an anatomical condition, so it's actually below the skin. The problem is it's in the fat layers, and it's connected with the type of fatty tissue there is. It's connected with the strands below that, pulling the skin in, causing the dimpling, and it's also connected to the skin tone as well. So there's different factors to consider when treating cellulite.
Now then, I just say, you boys try having a baby, because that just throws you back.
Brings water to my eyes, that thought. But cellulite for sure. So there are a few surgical options that help release the bands, okay, and release the tension and reduce the fat. You can do that. Non-surgically, creams some may temporarily help tone the skin, but it's not long term. And I think when people ask for that, is there a cream that does something long term? People are unrealistically expecting a cream to provide long term results.
For sure.
I think creams can help improve the appearance on a daily basis.
I mean, I think there's a lot of products out there in the market that all claim to be the miracle solution. But I think, would you say the best thing for someone to do is come in, have a consultation with you, and then you can determine the combination of treatments?
And I think what we need to do is show people results and real patient results from our clinic, you know, and then we say to the patients, you know, have a look at these. If you can see a difference, then it's probably that we can help you. If you can't see a difference or they don't meet your expectations, then they're probably not going to be happy with any treatment, because we only offer treatments which work, okay, and our patients are happy to pay for, you know, and I think that's important.
But the interesting thing isn't it, that nowadays the market has different knowledge, because creams, you know, to be promised the wonders of the world by creams, that is very 60s and 70s and possibly 80s, but that's not the case now. People know, women know, they are educated enough to know that, you know, some things you can't just achieve by a cream. No. Now then, Warren in Haywards Heath came to us and said, help, my man boobs are an embarrassment. What can I do? Okay. This is a very embarrassing condition for many men in our country, okay, and worldwide. It's become more and more prevalent, and people are more, they present themselves more to my practice, because I think men are now becoming more body conscious and image aware, okay, but something can be done about it. We know the National Health Service doesn't cover treatments on the whole for such conditions, and these patients are often dismissed by the National Health Service because it's not a service they can provide, okay, so they don't have the time to address it. However, many of these men have considerable psychological sequelae. They are affected by it. It affects them in many ways. It affects their confidence, it affects the clothes they wear. Certainly we've seen that, you know, many of them would not take off their tops in front of their partners. Okay, they would not go swimming with their children, okay, and this is a trigger factor for some of them. That reduces your life quite substantially.
Yeah, so they you know, they come to us and say, my kids are starting to swim now, and I don't want to go in the pool with them, and this is a trigger factor to come and have treatment.
In terms of the commitment that men have to make, I mean, what is the process in terms of coming to have this type of treatment?
So the first thing is that once they make an appointment with me, they need to understand that it's going to be an exploratory conversation, a consultation. I'm going to examine them, I'm going to take a full history from them, and I'm going to give them the time to talk and listen to them carefully. They're not going to be dismissed, okay? Because I recognise this is a medical condition, okay? And I can help them, okay? So when they see me, I'll examine them, explain to them the process. And the process, if they choose to go ahead with surgery, which I use Vaser as the surgical option, and it's a minimally invasive option, okay? The procedure takes about an hour, okay? And what we do during the surgery, we take an ultrasound scan of their chest first to assess the level of thickness of the breast tissue and any glandular tissue in there, okay? Then we do a pinch thickness measurement as well. And typically the male breast is, you can pinch about a couple of inches at first on a typical patient, and then we do the surgery, okay, which they will not feel a thing and they won't remember anything about it, so that's really important. And the scar will be only about the same size as my fingernail, so about 5 millimeters across, so it's very small.
Incredible.
Okay, and then at the end of the surgery we do another ultrasound scan image which confirms that all the tissue's gone and the thickness is reduced and the glandular's gone, and then we do another pinch thickness to confirm it's gone from this to this. Okay?
I mean, it does sound like an impressive treatment. I think, you know, if anyone is interested in considering this type of treatment or any of the other ones we've talked to, you know, we encourage you to obviously write an email, tweet, post a comment on Facebook so Dr. Jane can reply and book a consultation. Absolutely.
And with this procedure, is it like you really, you know, it's the old me and there is the new me?
Yeah. Well, I mean, first of all, people say, all the men say they wish they'd done this years ago. Okay.
Wow.
And we see guys in their early 20s all the way through to their late 60s. Okay. And it's the older men that, you know, they generally are very tearful afterwards because they wish they'd done it in their earlier life because it would have changed their whole life.
Gosh,
Okay,
yes.
you know, so and this is a condition which I believe should be on the NHS because the psychological scores change dramatically. You know, we have people that are 3 times more likely to go in front and topless in front of their partner. So just do what normal couples do: take off their top in front of their partner. 3 times more likely to do it after surgery than before. You know, so these are the statistics. 97% satisfaction rate. So
Wow.
very high satisfaction rates.
Mm-hmm.
Well, that's great.
It's easy to get sucked into following the latest trends, but sometimes it's a bad idea. Just think of some of those so-called fashion trends from the last few years. But sometimes a trend is a trend for a reason, because it takes the country by storm as it actually works. Botox is the perfect example. For a reasonable cost, 15 minutes off your time and a few needle pricks and your wrinkles disappear. So what are the latest trends that we're seeing at RiverBanks? Now we have Dr. Jane to tell us a little bit more. Dr. Jane, welcome.
Hello, thanks for having me.
First off, talking about skin boosters. Now, skin boosters, fillers, useful enhancements. Let's talk about what you do to improve the patient's appearance.
People are becoming more and more aware of the effects of Botox and dermal fillers, and they tend to be quite focused treatments. Botox addresses frown lines, for example, and fillers can address deep folds, okay, or loss of volume. But they tend to be quite focused treatments, and some people are naturally and understandably concerned that they don't want to look over-treated. Okay, they want to look like themselves. They want their skin to look fresher. They want their skin to look less tired, but they don't want to look like some freaks which they see, and often what they see on TV as well.
Exactly. I was going to refer to a particular show where those so-called jobs are on the agenda, and it is a horror story to watch. That's the other extreme, but you're at the other end of the scale.
Well, yeah, I mean, the most important thing, you know, and what I tried to get across the page, is that we want you to keep looking like you, okay? But we want you to
Absolutely.
look your best, okay? And to do that, we will treat the causes that have, the causes behind some of the signs of sun damage that you've got, the loss of volume, the dehydration. Now, skin boosters in particular use hyaluronic acid, which is the main ingredient in most dermal fillers. It's the safest ingredient in most dermal fillers as well. So that's the key, safety. There's years and years and years of data and studies and treatments to reassure us all that these are safe products.
Yes,
okay?
that was.
What's the difference between, you know, you've got your creams and then you've got this thing called skin boosters? I mean, could you say a good moisturiser skin booster, or is this something different?
Effectively, I mean, a good moisturiser will boost your skin. Okay. Again, on a daily basis, okay? And what skin boosters are, we're injecting effectively moisture into your skin. We're using tiny, tiny, tiny needle pricks, very, very fine, okay? And we'll do the treatment, you probably have a syringe across the whole face, and these are tiny droplets of hyaluronic acid, which are very watery, and they go deep into the skin. And the job of them is what they do, they attract fluid, high water to the area, tone up your skin. But what's recently been discovered is that they will also cause some collagen growth. So you'll get the stimulation of new skin growth with repeated treatments. Okay?
So is this like a typical result would be, you know, a woman going into the workplace and people would say, wow, you look great, rather than saying you've had work done? Is that something like a skin booster would do? It's
exactly,
like, yeah.
Exactly. You know, that is if someone says to me their friend guessed they'd had some work done, I failed. Okay.
Exactly.
Someone says to me
that
if someone says to me that, you know, people are saying I look well, I look fresh, then we know we've done what we said we were going to do.
Exactly. That you've had a good night's sleep look in your face.
Yeah. But skin boosters, it's typically a course of 3 treatments, and then you have 1 session every 6 to 9 months, depending on your skin.
Great. Now, one of the other questions that, you know, we would love to discuss further is about regulation, and a lot of people do get scared off by these horror stories or who's injecting different types of treatments. And obviously there's a lot of hype at the moment in the media with this Keogh report, etc., about tightening up the industry. I mean, what do you feel about the regulation? Is it going in the right way? Are we going into a more safer environment? What's your thoughts on that?
It needs to get into a safer environment for sure. Okay, you know, it's not the fact that I mean, at the moment, almost anybody can inject anything, so there's no regulation at all. You know, and unfortunately, a lot of people, the only deciding factor for them is price. Okay, so they will go to the cheapest place. Okay, that doesn't mean they're going to get the worst treatment, but it certainly doesn't mean they're going to get the best. Okay, and you certainly have to have detailed knowledge of who you are being treated by. You know, it's not just their medical qualifications, which I believe it should be a medically qualified person, but they need to be able to understand you know, the full anatomy, and it's not just medical anatomy. You know, there's beauty as well. What's the face about? You know, what makes a face attractive for that particular individual?
Yeah.
You know.
And what effort does RiverBanks undertake to reassure and educate patients and prospective patients that this is the case here?
Yeah. On my website, all of my qualifications are listed. Okay, we are fully regulated by the Care Quality Commission, which we pass unannounced inspections. Okay, I'm regularly travelling the world to go to the conferences to keep myself up to date. I'm also fortunate enough to be able to participate in many of these conferences to teach other doctors and health practitioners as well. And we regularly perform audits and customer patient surveys to check that we are meeting their expectations. I mean, it's very important to us to maintain the high standards. I want people to be able to trust us. And if we say something doesn't work, then trust us. It's not because we don't want to do it, it's because I don't feel it's in their best interest. And you know, and you know, in medicine we can never guarantee 100% will be safe, but you know, we're pretty close to 99-98% that we try to make sure that everyone gets what they need.
That's really good to know, Dr. Jane. Thank you very much.
Yeah, thank you. Well, I'm here with Corinne and Dr. Jane, and we're going to be looking at a lip augmentation procedure. Now, Dr. Jane, what are we going to be doing today?
Okay, so Corinne likes to have her lips in a more contoured shape, a little bit more volume to the upper lip, so around this area here and there. So we're just going to try to bring the top lip to be a bit more voluminous, okay? And then the lower lip, we're just going to enhance the definition slightly, but the aim is also to try to make them a little bit more defined. Okay, so this is what I call high definition lip contouring.
So, I mean, obviously less is more, because you see a lot of these celebrities with these big lips and stuff. So are women looking for just those little touch points that can...
Yeah, okay, most people are petrified of having their lips treated, yet they do want something done about them. The key here is we're using safe product, so we're not using any permanent products in the lips. We're using hyaluronic acid, we're using the MFL brand of hyaluronic acid, which is extremely safe, okay? It is reversible as well, so we have that little insurance policy in our pocket too. We can change it if it's not quite up to the level that we both, the patient and I both want, okay? There's no real safety concerns on this compared to some of the other older products that have been around the market that have caused some disasters which have been well publicised. So for young women like Corinne, they tend to like a more contoured shape. People older in their 40s and 50s want to reduce some of the fine lines around the top lip that sit up here, and also they tend to lose a bit of definition, so they just want some restoration. Whereas the younger ladies tend to go for a bit more contour enhancement.
Now the lip area being a more dynamic area, how long does the product last for?
Lasts for about 4 to 6 months tops for most people.
4 to 6 months,
yeah.
Right, okay. So Corinne, what made you think about having this in the first place?
I initially wanted to actually have my top lip balanced out with my bottom. I felt that when I smiled, that it did not quite balance on my face. I didn't tend to want to smile in pictures, and I just felt it was going to really boost my confidence in terms of being in front of the camera, being with my friends, and actually smiling with my teeth. And balancing out with my bottom lip, I genuinely found it did that.
So you've had how many treatments?
I've had 3.
Some filler into the border of the lip, and now, without making a new needle point, I'm going to go into the body of the lip. There we are, and we're going to inject to give some shape to the middle of the lip. And then put a little bit less on the way out.
How are you feeling, Corinne?
Fine.
All good?
Yeah.
Did it hurt?
No, not at all.
So you're just creating a little bit more volume in the
A little
lower
bit
lip.
of definition in the lower lip, and what I'm
Definition.
going to do is I'm going to place some extra volume right in the middle to give a really little bit more contour and shape. So what you can see is that Corinne doesn't look like she's got swollen lips at all. You can see now that we have a nice Cupid's bow and a little bit of definition into the middle of the lower lip. And these are subtle treatments that will help improve. There we are, no bleeding at all.
How you feeling?
Fine. Really good.
Great. Well, that's all we've got time for today. Thank you for watching.
If you've still got any questions or would like more information about the treatments featured, don't forget you can email or contact us through Facebook and Twitter.